Thank you very much indeed, Lee. It's great to be here tonight. I think that the voluntary sector is at its best when organisations like yourself collaborate in shared activities like that. It amplifies the message, gets it into the minds of decision makers like myself and my colleagues on the panel today. And we stand to have a good debate. And I actually believe that much of the panelists will agree with everything I have to say. I think we can try and find consensus on this most important issue, because it is the most important issue to my mind facing Scotland right now. We aren't facing a coming pandemic in mental ill health. That pandemic is already here and has been here for some time. In fact, it was the Liberal Democrats in the Scottish Parliament that led a debate just before recess, which declared a national mental health crisis in this country. And that can be summed up very simply. If your daughter fell off her bike and broke her arm, you could expect her reasonably to be in plaster by the end of the day. But if she came to you with self-harming behaviour or depression or anxiety, then she stands to join the longest queue in the National Health Service. It is a deeply, deeply troubling issue. Each of us has our own connection to mental health. It is a ubiquitous political issue. It reaches out and touches every single life in one way or another. For myself, I was a primary mental health carer for an immediate family member for 5 years. I remember the anxiety that gave me. It put me in therapy. I had a problematic relationship with alcohol for a time to deal with the anxiety I was feeling myself with that caring relationship. And I was the first responder at the scene of a suicide in Edinburgh. I had an ambulance there 90 seconds after this man jumped to his death. But had he walked into a GP surgery when he started to feel unwell, he could have waited 9 months or more for the care that he was sadly never able to access. We will rehearse, I think, in detail the extent of the mental health crisis in Scotland, but it is a particular crisis in Scotland because, for example, Scottish suicide seems to be particularly Scottish. That our rates are higher than anywhere else in the UK. It is the leading cause of death for men under the age of 50 in this country. It's linked obviously to the drug deaths emergency as well. People are self-medicating for unresolved trauma through unresolved adverse childhood experiences, and that is leading them sadly to overdose and other problematic health-related issues, to drug and alcohol use. On adverse childhood experiences, I agree with Sir Harry Burns. When he was commissioned to do a review into NHS targets, he said the one target we're not measuring, which we should be, is adverse childhood experiences. We're not capturing that. We don't know who has a high ACE score, and as such, we cannot identify those people who in early life have had a molecular or genetic level change in their brains, which can be healed with the appropriate interventions and support. And speaking of children, I think that it is still a national scandal that we have more than 1,000 children waiting more than a year for first-line adolescent child and mental health treatment, and that has only worsened in the pandemic, and particularly around the closure of the schools, the fact that children have by necessity had to withdraw into their bedrooms and learn in their bedrooms, socialize in their bedrooms. They're missing out on the society of their peers. They're missing out on exercise, all of these things which are really important to child development and which will have a detrimental impact on mental health. It is an economic issue as well. 300,000 days are lost each year to mental ill health, or caring for someone with mental ill health. And if you start dressing things up in the financial impact, then politicians unfortunately start to take more notice. So perhaps we need to do more of that. I'll finish with this, a couple of things. Firstly, it isn't a problem just of money. I mean, we have been chucking money at mental health, and I'm sure Emma will talk about the size of the budget for mental health in this year's budget, which is one of the conditions that the Lib Dems put to supporting or lending our votes to that budget, was an increased uplift in mental health spending. It's about recruitment. 1 in 8 specialist positions are still unfilled in child and adolescent mental health services. We do not have a counsellor in every school helping children to deal with trauma, attachment disorder and loss, and the other massive trigger points which might lead to a lifetime of mental ill health. And I'll finish with this, convener. I think it's fair to say that I still have anxieties about government overreach in mental health. The Coronavirus Act, we supported grudgingly when it was first introduced this time last year, which actually removed some of the civil liberties attached to mental health and some of the safeguards attached to the Mental Health Act. So right now, because of the emergency, you don't need need a second clinician to sign off on an order to put you under secure psychiatric care, which was always an important human rights safeguard. There's no reason under the terms of what's happening in COVID for that still to be the case. And secondly, you can have your detention doubled, again, without recourse to a second opinion. And again, that's got nothing to do with COVID. So I've been an advocate every time we've renewed and refreshed coronavirus legislation to ask why this is still needed. I will continue to do so, because I think those people with profound and acute mental ill health need a voice where they don't otherwise have one. Thank you.
Thank you very much. Yeah, I'll maybe just kick off by that. Can no longer run as fast as I once did, but I'm on the board of Scottish Athletics at the moment, and I'm really proud of their connection with SMH and the job leader focus on ensuring that it's not just about physical health. So a lot of good work going on there, and I know that's, you know, the area of social prescribing and exercise and so on is one that's very important to many professionals working in the field. Well, I believe that we need a fairer recovery from COVID. Obviously, I'd like to see a fairer green recovery from COVID, but really that is just about making sure that it's socially just and we come out of COVID in a better position than we went into it. And of course, when we went into it, we're all too well aware of those well-publicised, seemingly intractable waiting lists. In particular, I think in Parliament, the one that we always mention is the CAMHS one. Now, that is symptomatic of a system that is absolutely creaking. In fact, it's worse than that, isn't it? It's clearly under-resourced. There isn't enough capacity for the demand. We know the stress that rejected referrals has on those families who have finally made it through the CAMHS door. And if that referral is rejected, where do they go for help? So I want to see a no wrong door approach. You know, the Scottish Greens are absolutely determined that everyone, we need to ensure in this next session that everyone can access mental health support where they need it. So we are talking about counsellors in schools. We would like to see a mental health clinician in every GP surgery. Also in that surgery, we'd like to see a welfare rights advisor, a well-qualified welfare rights advisor, because so many people are under stress as a result of poverty, as a result of job insecurity, particularly during this time, as a result of an insecure housing tenure. These are all things that put people under stress. So as well as looking at the solutions and ensuring that we have the services that people need when we need them, we need to look at the causes too. So I think a community links worker as well would be very welcome, someone who understands what is available in the community and where people can go to find it. We'd also like to see 15-minute minimum GP appointments so that GPs have time, because so many appointments in the first instance are with regards to mental health. We'd like to establish a triage system in every community in Scotland so people can quickly be assessed by a mental health team and connected to the right support. I think as a preventative measure, as a way of stopping a situation becoming chronic in nature or becoming acute and then chronic, we have to have these services in place. We'd also like to expand access to cognitive behavioural support where that's appropriate. As I've said, social prescribing, exercise referral schemes, and peer support. But if we're looking at peer support, we have to make sure that society is aware of mental health. We need to understand that it can affect any of us at any time. I think we're all too well aware of that. We need to understand too the links between self-harm and suicide, and we need appropriate strategies in place to deal with both of these. When I've been looking at manifestos during the campaign, you know, the other morning I was reading the Royal College of Nursing's, for example, and it points out that there is a shortage at the moment of 660 mental health nurses. You know, this is indicative of the scale of challenge that we face. It is, and I'd also like to do more. I'd like to understand, are we speaking? I think it's fabulous that we're speaking about it. You know, we didn't speak about this when I was at high school, but you know, I have a university student at home just now, and it's something that's regularly discussed. I think that's really helpful. We've still not removed the stigma, though, that we need to. People are still far more reluctant to discuss mental health than they are to discuss physical. So we've got to change that. There's still work to be done there. You know, why is that the case, that it's seen as some sort of personal weakness? I think we need to do more for our young people. I do believe they've been particularly hard hit at this point in time. You know, as I say, university students have been learning from a Zoom screen since September, often in bedrooms by themselves, away from home, without any family support. So we are going to have to make sure that when we come out of this pandemic, we're ready to deal with all its impacts. So I think we need to prioritise, I'm watching my time here, providing children and young people with the dedicated mental health support they need. And we're speaking about investing additional cash into child and adolescent mental health services and doubling the budget for community mental wellbeing services for children and young people. I realise my time is up, Lee, so I'll stop there, but very much looking forward to this evening's discussion. Thank you.
Thank you, Chair, and to all the guests who have come along tonight. And yes, my name is Carol Malkin, and it is a pleasure to come and speak to you tonight as Scottish Labour spokesperson for mental health and older people. And this is, in fact, my first official discussion panel in that role, so it makes it all the more exciting. I think that's the word, to have the opportunity. So make no mistake, I was delighted when Anna Sarwar asked me to take this role on. It's a great honour to be able to speak for your party, and I believe the Labour Party has shown great commitment to services and wants to see a renewed focus on mental health services across the whole spectrum of need. The approach we see here tonight of organisations coming together to form a more collective voice and influencing the development of services is essential, and certainly an approach I would favour, and I'm glad to see it's prevalent sort of throughout Labour's plans for the national COVID recovery. To give you just a little bit of information about myself, I'm probably the least known. I trained in the 90s as a dietitian, and I worked in London and Watford, and then returned to Scotland to work in learning disability services, where I found myself absorbed in what was at the time very exciting work, looking at how we transformed services. And through my work, I met many people who had often spent a lifetime in very dated and disjointed services and environments. And I was lucky enough to see transformations in services and organisational structures that allowed people's lives to be very different. And this has stayed with me and actually motivates me right to this day. In recent years, I've had a very different role, and I spend most of my time as a full-time mum. But that sort of 17 years in the health service has kept me engaged in community work and community services. And I believe that this networking of services, communities and clients is key to getting it right for everyone. Everyone's mental health and wellbeing should be should be the heart of all our health and care services, and it applies at every stage and in every walk of life. And that's the reason that we must talk about how we ensure a sustainable and adequately funded strategy that covers all strands of the equation. Trying to think about what do we know about current mental health services? We know that even before the pandemic, mental health services were stretched and struggling. And we know that waiting lists were getting longer, and this has continued throughout the pandemic and is expected to continue. We know that Scotland has the highest rate of suicide in the UK, and so more needs to be done to support suicide prevention strategies. And we also know that areas of deprivation are hardest hit by austerity and lack of resources, and this is shown in the figures for mental health crisis. So tackling root causes of mental health problems are essential to the overall strategy. We know that the government will argue they've offered funding to mental health services, but this has generally been reactive rather than proactive. And overall, the approach to mental health service funding has been a bit piecemeal and slow and often bureaucratic. Overall, in the last Parliament, the funding as well as the management of mental health services has been poor, lacked vision, hasn't tackled those health inequalities. And importantly, many essential services tell us that the way in which funding has been given has actually hampered their ability to be sustainable. So what can be done? What would Scottish Labour want to do? Well, Scottish Labour want to transform the mental health strategy, strengthening the links with social infrastructures, and in particular have stronger and better integration between education, social work, NHS and the third sector. In the community, we want to see better investment in our psychosocial infrastructures. People need good quality homes, accessible community health services, shops, community centres, sports facilities, pleasant spaces to work and relax in, and fundamentally they need to have meaningful engagement in the communities. Funding of mental health services must be long-term to allow the whole spectrum of organisations to plan and develop in a much more sustainable way. And connecting services up, we have to have a strategy that looks to promote and sustain mental well-being. We need options available to people at the earliest stages. We need initiatives such as the distress brief intervention. We need services well used and the opportunity to connect someone with a whole range of support services, from welfare advice, housing to health service. We want people to have good access to quality jobs, and in the workplace we want to have good employers who understand the need for a healthy environment, for good work-life balance, and have policies that support good mental health. And the workplace links with the trade unions will help. Many of the trade unions have done extensive work on employers and how we make sure there's benefits there to support mental health. So in conclusion, we need to look at the whole picture. Scottish Labour want to refresh the mental health strategy. We need to make choices about our overall direction of budget, and we need to properly fund mental health services whilst tackling inequality and targeting money at the communities that need it most. Thank you very much. Thank you.
Thanks very much, Leah. Yes, sadly, I've now crossed over to the dark arts of our Whip's office in Parliament, but for most of my time as an MSP, I have been on the Health and Sport Committee and actively involved, as are all MSPs on this call, in trying to progress improvements to mental health across Scotland. I'd like to start by thanking everyone on this call for the work you do. One of the biggest surprises I think I found 5 years ago was just how much mental health crisis we as MSPs end up having coming to our doors. People who just are at the end of their tether in trying to find support, either for themselves or a loved one. And I think that's something we all collectively in this Parliament and the next need to improve. So I very much welcome the partnership's proposals. I think they're three key improvements which we can take forward in the next Parliament. And I think there will be a lot of consensus from what we're hearing this evening. I think between the five of us, we can put forward some good ideas, which I hope we can all take forward in Parliament. For me, one of the key things has been, I don't think the speed of reforming and improving mental health services has been good enough over the last 5 years. I remember doing a mental health hustings 5 years ago, and we were talking about this Parliament we've just come to an end, delivering parity between physical and mental health. Now, I don't think we've achieved that, and the pandemic has, in fact, put that back to some extent. So we really need to make sure that as we come out of the pandemic, mental health is a key priority. And the pandemic has really underlined the need for investment in our mental health services and reform. And I think actually going forward, there will be even different ways we have to look towards delivering services, because everyone's mental well-being, I think, has been impacted by the pandemic. No one on this call, I think, would say they haven't been impacted by the lockdown especially. But in Scotland today, 1/5 of patients waiting too long for treatment. Here in Lothian, Alison, Alex and myself will regularly write to the health board to be told adults will have to wait 2 years before they're seen. 2/5 of vulnerable children are waiting for CAMS, again, here in Lothian specifically, up to a year sometimes before children are seen. And I think all of us find that completely unacceptable, and we need to try to build different services, different early intervention especially, to transform that experience people and their families have. And I've seen over the last year in my own casework the impact of the pandemic at a level for children which is deeply worrying, and I think that has to be a priority for all of us. I know children who are now presenting with anxiety, yes, but huge increases in eating disorders and self-harm. And for very young children, a real reversal in their development, going back to sleeping with their parents, toileting issues, which they'd never had, things in terms of child development, which we're all going to have to address and put resource into. So I hope we can look to the future very quickly. We can get the new Parliament focusing on these issues as it should do. And I think there can be consensus as we come out of this election on what's needed. Now, in time I wanted to outline a couple of suggestions which I'm keen to see. Ultimately, extra investment is needed, and I would like to look towards parties looking to dedicate a proportion of NHS spend to mental health in the next Parliament, so we don't have this constant battle to see if we can get a wee bit more money at every budget. I think we should look towards genuine parity if we're going to achieve that. Rejected referrals, as Alison said, is a real priority. I don't think anyone reaching out for help should be rejected, and I think we need to build our mental health services to make sure that never happens, because the worst thing possible is someone being told, no, there's no one to see you, come back when you're worse, often is what's put to me. So I think we need to see that really revisited and reforms put in place to take that forward. Workplace mental health is going to be a huge thing. I think the changes we've seen during the pandemic really will present the need for a new model. If we're going to see more people working from home like this, speaking down a computer, I think that will present even more mental ill health. And we need to make sure that workforces are actually proofed so that support is available, especially the private sector employers not necessarily putting that in place. Community mental health services play a huge role, and I'd like to thank everyone who's involved in the third sector organisations who provide that. I think we will really need to see that investment beyond this lockdown to make sure we can build our community mental health services. I think social isolation is a huge issue, which this pandemic's really highlighted, but there's so many opportunities to connect people to their communities. And I've been involved here in Edinburgh with a number of projects, but I really think we need to invest to make sure that happens, because the early intervention we see around that can stop people being clinicalised later on. So I hope that's something we can look at. And finally, because I think I'm maybe over time, sorry Lee, I think we really need to look urgently towards 24/7 mental health in A&E, for example, and trauma-trained public services, because I know over the last 5 years, a police response to trauma isn't good enough, and I think we can all do better. I think our public services can deliver more. So the message finally to conclude is I really think we can make mental health and mental well-being a key priority in the next Parliament, and I hope all the parties and all the MSPs lucky enough to serve will make that just the thing we have to work together to achieve.
Okay, thanks Lee. I am a member of the Association of Perioperative Practice because my background is in operating theatre and trauma surgery, and especially when I worked in California. So, but thanks everybody for being here, and thanks for inviting me to be here at the Scotland's Mental Health Partnership hustings this evening. I will be as quick as I can. I've been listening to everybody's opening remarks as well, and a lot of what I will say will probably resonate, because the last mental health hustings that I attended, it was very collaborative and very supportive, because we all know how important it is to support mental health, and rather than scoring any other points, and that's what my goal is to do. As one of the co-conveners for the Mental Health Cross Party Group, I've found that my other two co-conveners, Beatrice Wisher and Oliver Mundell, we've been very good at chairing events and working to come up with goals and actions that we can then support writing to the Scottish Government about. So, and we've all been keen to, well, and I'm also keen to follow the progress of the Mental Health Review by John Scott QC, and we have conducted a number of short inquiries with reports that have been published by Sam H, who is the Mental Health Secretariat. And obviously we've seen how the COVID-19 pandemic has had a substantial impact on the mental health of many people across Scotland, our older people, our young people, our isolated people, whether they're rural or urban, because obviously you can be isolated still in an urban area. And for me, promoting the health and well-being and improving the mental health of people in Scotland is a priority for the Scottish Government. And with my nursing background, I was keen to be involved in a lot of health cross-party groups, and mental health is just one of them. Diabetes is another, and we had a co-mental health diabetes cross-party group, because a lot of mental health issues do cross over with other chronic health conditions as well. in looking at the mental health transition and recovery plan, which was published just in October 2020 there, it does set out actions that the Scottish Government is taking forward in response to the mental health impact of COVID. And obviously that's high on the agenda. Our Finance Secretary announced additional funding of £120 million and for the Recovery and Renewal Fund, which means that the total spending on mental health in 2021 into 2022 will be in the excess of 1.2 billion. And I know Alex said that I would mention these numbers, but we know that it's not just about money, it's not just about financial input, it's also about looking at the whole wider aspects and like obviously supporting people with crisis intervention and other issues around economic impact of mental health. I've learned a lot from attending many events and meetings, and Catherine Trebeck presented at the Rural Policy Cross Party Group, and she talked about the economic impacts of mental health and basically said that if we do whatever we can to prevent mental ill health, we can do a lot more to support economic support in our communities as well. And other issues that I've looked at, like raised issues in Chamber and Committee, in Health and Sport Committee, and I think mental health is gaining parity with physical health, because we're now evolving in the language we use. We talk about health and well-being now, because we know that physical health and mental health are totally intertwined, and I think that the gaining parity of esteem is it's moving towards there if it's not right up there already. Other issues that I am keen to promote is looking at social prescribing. That is one area that in evidence at Health and Sport Committee, we looked at making sure that that got more support, and our third sector is crucial to supporting that. And also, like last week, I was at a vaccination clinic because I'm a vaccinator right now, and one of the ICU nurses came for her second vaccine and told me about how the ICU nurses were suffering from mental ill health because of the pandemic, because they're worried about their own family, they're worried about themselves, they're worried about their own safety, and of course they're dealing with people that are fighting for their lives in ICU. So we do need to make sure that people who are the health professionals are supported. We need to make sure the public are supported. And one of the other issues I'd like to bring up, I'm not sure how much time I've got, Lee, is adverse childhood experiences. I'm a member of the Adverse Childhood Experiences Cross Party Group, and John Swinney spoke at the first meeting and the last meeting, which was just last week before recess, and spoke a lot about how prevention and early intervention and supporting young people to get the best start is something that we need to continue to be focused on, and prevention of any escalation and prevention of crisis is something that I'm keen to support. Also, distress brief intervention is being rolled out to a wider healthcare staff, as well as police and as well as our ambulance service, and obviously that takes time to roll out, but luckily for us we've got a mental health minister who is a mental health nurse, the first mental health minister in any UK government. So, and I will stop right there because I am happy to engage and continue to take questions in there. So thanks, sorry if I overran.